If we want a cancer patient not only to live, but to have quality of life, there has to be a balance between reality and hope. But we have lots of treatments that prolong survival. We're trying to get at what does that cost society and what does that cost the patient? Take into account side effects, what a patient will pay, how diverse patients respond to treatments, and what side effects they experience. There are layers of cost to patients, time lost from work when they come to clinic. Treatments that require more visits and more clinic appointments are more costly to that patient. Co-pays obviously can be quite high for some of these oral prescription drugs like abiraterone or enzalutamide. There's the cost of side effects in terms of both inability to work or quality of life. That legacy, I don't want to leave my family with a bunch of bills. And we get into really complex questions like, should I adjust my life insurance policy or start making withdrawals based on how long I'm going to live? We're trying to guide patients based on what we expect their life expectancy will be, which we're also not particularly good at nailing down. If you get the call from specialty pharmacy and your copay is high, call us, don't pay it. Then I have a whole team of pharmacy tech and medical assistant who work on all the paperwork to try to knock down, to access the patient foundations that help with copay relief or to access the copay cards and those sorts of things. So if a doctor can't get the medicine for their patient, then they haven't completed their job. Prostate cancer has unique challenges in this realm. Many patients feel completely fine, and they wouldn't know they had prostate cancer unless they saw their PSA number and looked at their scan and saw spots on the scan that represent metastasis. So quality of life is definitely going to be decreased when we start a treatment that has side effects. The other thing that's so unique about prostate cancer and side effects is the whole sexual function domain, because our hormonal therapies really impact libido, they impact sexual function, and so these can impact relationships. And that's a conversation that we don't have often enough, but for men with metastatic cancer, it's more likely this is going to be a permanent change, and that's a really tough one. So even though a drug may have side effects, even something like chemotherapy, which is known to have quite strong side effects, when you actually score the boxes on a quality of life survey, you can often see that people are feeling much better when we are treating their cancer, even using these very strong medicines. It's easy to say because I'm not the one with the cancer, I'm not the one feeling the day-to-day side effects and taking these pills. But in my view, having been treating prostate cancer for 15 years and having seen men live and men unfortunately die, what I see is that these drugs significantly prolong life and they significantly improve quality of life. Most patients ask a lot of good questions, like, what is my day-to-day going to look like on this treatment? That's just really hard. You know, we can only speak in generalizations as what we see, knowing that there are always outliers.